Hi, I'm Professor Jim Lambert, and I work in the Department of Civil Engineering and Environment, and also in the Department of Systems Engineering, Systems and Information Engineering. My expertise is to track sources of risk and countermeasures of risk in large-scale systems, and that might include public health systems such as for a pandemic or another emerging threat to public health. So what I'm going to do is tell you some of the principles that I've used working with across architecture school, the College of Arts and Sciences, the environmental sciences here, and even the health sciences, also with the Survey Research Center, some sociologists, and the law school, others. What I find our sponsors are looking for from UVA engineering is that we are broad and reach into the humanities and across disciplines. So hopefully what I'm going to show you in the example coming up is going to give evidence of that. I was just in Sicily in the World Federation of Scientists and asked to talk about wildfires. It reminded, I was in Australia some years ago as the president of the Society for Risk Analysis, and we had the phenomenon of asthma thunderstorms or asthma storms. I've never heard of them. I thought we need to bring those to the United States. They're probably occurring, but we're not so far aware of them. And this had just been occurring while I was at the meeting in Sicily, all the wildfires you all know well from the news. And I took the project that we were working on, which is to bring forest floors and debris from forest waste into the biofuels for aviation, and that was the example of a large-scale systems project that UVA is able to work on with a society that does planetary emergencies. This is reminding that many health emergencies and public health emergencies, they can be a consequence of all that we've moved around the earth, soil and debris from forests, and the fires themselves are a way of moving those tons of material. So let me show you, if we do some proposals together, that we'll be working from my side on methods and principles from systems design, and also identifying risk, managing risk, and then asking, was it effective? So I almost exclusively now have jumped over identifying probabilities and severities of threat. That's some from the 1960s and 70s. And now I'm asking for any large-scale system, how is the order disrupted? An order could be an order of hospitals, could be an order of schools, such as nursing and medical schools, could be an ordering of communities, an ordering of people, an ordering of contaminants, toxics in the environment. And in the slide we're looking at here, for Amazon, which started as a bookstore, it would have been the order of books at the beginning. Now it's the order of their partners and in China and elsewhere, their products and suppliers, customers, and anyone telling a large system such as that, which involves freight and information systems, what's the disruption of order this week into next week and further? That's the value of what I'm doing and able to offer to this panel, hopefully today. So what I'm going to show you is an example with wildfires, but relating all the sources of risk to wildfire countermeasures in technical performance, but also in cost and schedule. And I'm going to be asking, what are the scenarios that most and least matter to system order? This could be a map of public health. We saw some of the contours of that in another presentation today. But it's actually a map of a forest floor and where's the debris. This is a heat map also for the fires, occurrence of fires. And the project that I'm working on with this World Society of Scientists is to bring that debris into pipelines and then evaluate how it's doing, not only to reduce the forest fires and wildland fires, but also to bring some benefit, decarbonization fuels for aircraft. This is an example of disruption of system order across a large supply chain on the East Coast of the United States. All the rows of this chart are the investments, and there are tens, dozens, and hundreds of these in any case that I've done, including this one. And if a component of a system falls in priority, then it lights up red. If it rises in priority across some set of scenarios, then it lights up in blue. And this is an example of what are the scenarios that are most disruptive to system order. And in this case, we had a pandemic combining with other factors. So to wind up, my home society is the Society for Risk Analysis with about 2,000 members worldwide. I chaired the World Congress on Risk in Cape Town in 2019, but also the Systems Engineering Societies, where we are careful to document knowledge of processes and the people and the inputs and the outputs and the performance evaluation. A system has purpose and it has structure, and the parts of it have functions. That's what we teach in our classes as optimization, and when you come over to the engineering school, that's what we're doing there. Also, the idea that this topic for today with the human health, it involves distributed sensing, optimization of sensors, combining latest sensing capabilities with databases. My colleagues and I have a book that addresses that. Also, we're very welcome to working with governments, with military, with industry. I've been doing that, project building and brewing, I think we're calling it later today, with agencies and all that I described. And that's the end of my presentation. I look forward to working with you all. My center associate director is Pam de Guzman from, I think she's in the nursing school here. So already we're connected, and thank you for inviting me today.